What are some of the health benefits that were discovered in this research between people and their pets, or pets and their people?
Right. I looked at a lot of research preparing for this segment, and it was very, very fascinating how many health benefits are associated with having a pet, both mentally and even physically. Because the bottom line is, having a pet, the research has shown that a person has a better sense of calmness. They have less stress, less anxiety. They even have benefits that are medical. And some of these medical benefits result from the decreased stress. One example is they've shown that people that have pets tend to have lower stress hormones, to include cortisol. Now, cortisol is one of those hormones that's released when you're in a stressful situation. And if you have prolonged stress, then you'll have elevated blood pressure, have elevated heart rate, which can both lead to cardiovascular disease. And we did talk about the fact that Mississippi is one of the highest states with the highest prevalence of people dying from cardiovascular disease. But also, having increased cortisol results in more poorly controlled diabetes and other medical problems. But having pets, according to this research, decreases that cortisol, decreases that stress. It just gives you an overall better sense of health.
And Dr. Quinn, are these research findings used to support emotional support animals as well?
Most definitely, because most of the individuals that have emotional support animals, and I had to do a little bit of brushing up on that as well. I've had a lot of patients that have requested emotional support animal letters. And basically, this is law, where if you are diagnosed with a chronic medical, emotional, or psychological problem, you can be prescribed an emotional support animal, mostly by therapists or psychiatrists, but primary care physicians such as myself can do the same. And if a person has this medical diagnosis with this prescription for this animal, if they live in an apartment or an area that does not allow pets, then they have to let them have their pet, and they don't have to pay extra fees. But the take home is, the research showed that individuals that have these emotional support animals, to include dogs or cats or even birds or even fish, benefited from these animals. So this is really fascinating and encouraging to all the pet lovers out there.
Real quick, have you ever recommended any of your patients get a pet?
I have. And actually, I'm a pet owner as well. My daughter, she got a rescue dog about maybe 10 years ago. And I took the dog to her mom's house, and the mom was like, "Oh, you got a dog?" And I was like, "What do you mean? This is chaperones." But long story short, I took the dog home, and the dog has been with me for 10 years. And I love that dog. And I noticed when I get off work, I'm really riled up, and the dog just helps me calm down. But now I have my wife to help, and I'm just a calm, happier guy and healthier.
Notice that about you. You're much calmer now than you've been. Dr. Timothy Quinn, thank you for being here this afternoon.